So what is keratometry and corneal topography? Corneal topography is a painless test that produces color-coded maps of the cornea. The cornea itself is the clear outer surface of the eye. It has a slightly curved shape that refracts or bends light as it enters the eye. Corneal topography evaluates the shape of the cornea to diagnose and manage different types of eye conditions. The cornea can be smooth or dotted with bumps or other unusual features, but normally we can't see these features on the cornea, and so this technology allows eye care specialists to map and measure the cornea. Corneal topography has many different purposes. Specifically, it helps to diagnose and monitor conditions that affect the cornea. It also helps in planning for surgery on the cornea and evaluating the results. It helps to fit contact lenses to the shape of the eye, and also helps with diagnosing and monitoring conditions such as astigmatism, keratoconus, pellucid marginal degeneration, otherwise known as PMD, scarring from injuries or infections, as well as growths such as surfer's eye. Corneal topography might be necessary if there's an upcoming laser refractive surgery like LASIK, if surgery is needed to treat a corneal disease, or if providers need this test to evaluate the results of post-surgical conditions. Contact lenses are needed, and corneas have an irregular shape. So how is corneal topography normally done? The procedure is quick and painless, and it involves first having the client sit in front of a device that looks like this large bowl. They're going to rest the forehead and chin in the designated spots and stare at a point inside the bowl as the device captures images of the eyes. The device converts these images to a series of color-coded maps. And the whole process takes just a couple of minutes. There is no pain and the device never touches the eyes. The corneal topography test produces a series of different maps that display colors and numbers. These maps show the surface features of the cornea, including spots where the cornea is steep or flat. The test can produce many different types of maps, including the axial map, also known as a sagittal map. This is the type of map providers use most often. It shows the curvature of the cornea, or what you might think of as the different peaks. There's also the elevation map, and this map compares the cornea to a best fit reference. It tracks elevation, or how much the cornea curves outward. Warm colors and positive numbers indicate that the cornea's measurements are higher than the reference. Cool colors and negative numbers indicate that they're lower than the reference. There is one map for the anterior or front surface of the cornea and another map for the back or posterior surface. There's also the corneal thickness map, otherwise known as the pachymetry map. It shows the thickness of the cornea, and there's no one thickness cut off for a healthy or unhealthy cornea, but significant thickening or thinning can be abnormal. So certain conditions like keratoconus cause thinning of the cornea, and on this map, cool colors show thick areas of the cornea and warm colors show thinner areas. Corneal topography interpretation involves analyzing these colors and numbers, and the provider will interpret them and let the client know what they mean. So what is keratometry? The keratometer is the standard instrument in ophthalmology for measuring astigmatism. So clinically, this corneal curvature data is used for contact lens fitting, IOL calculations, and corneal refractive surgery. It's also helpful for detecting irregular astigmatism, which is visible as distortion or irregularity in the appearance of the Myers. Thank you.